It's a chance to help younger cancer survivors struggling with depression.
An assistant professor of psychology at ECU is getting a $750,000 grant that'll support the development of a digital self-management tool.
Now to your side's Gabby Sartori joins us from the newsroom. Gabby, you spent the day speaking with one of the team members working on this project.
That's right. Dr. Carly Murphy will be leading a team of collaborators in ECU's Brody School of Medicine and Wake Forest University School of Medicine. Together, they're finalizing the content of their tool, which is tailored to better understand adolescents going through everyday life with cancer.
Our process right now, we started out by doing some user-centered design with adolescent and young adult survivors, where we ask them, what do you want in a tool that is going to help you better manage symptoms of depression? How do you want to interact with it? What do you want it to look like? And that helped us to design a prototype that has a bunch of different pieces to it.
The tool is targeting adolescents because of the amount of growth their stage of life has. Something like cancer could prevent them from dealing with those emotions on top of the stresses of their condition.
They're already going through all of these developmental transitions. They're finishing up their education, starting their career. They might be dating or getting married or starting a family. And cancer gets in the way of all of those things. And it's really problematic for them from an emotional standpoint because it's really difficult to relate to your friends who haven't gone through something like this.
Cancer patients between the ages of 15 to 39, known as AYAs, can be prone to depression symptoms because of how much both their cancer and depression have progressed. With the absence of a mental health tool currently, Murphy knows her team's tool will make an impact.
My hope is that we'll be able to develop a tool that when somebody who is an AYA tells their doctor, hey, I'm having some symptoms of depression, or they screen positive on a depression screener, this is something that they can be handed that day.
Murphy added that the tool will be beneficial for adolescents battling cancer because now they will be able to have a source to cope with the emotional toll of their situation. It will also show that throughout their situation, they're not alone. In the newsroom, Gabby Sartori, 9 on your side.